Hello again, this is Dr. Alex Martin. I'd like to talk to you today about stem cell therapy for your knees. Why do we need stem cell therapy for our knees? Many of us are facing knee destruction and knee damage where we are seeing degenerative problems in our knees. We're seeing destruction of the cartilage, narrowing of the joint space, and also on the x-rays and MRIs we can see bone against bone. This is creating a lot of pain, a lot of dysfunction. We're not able to run and much less compete. And some of us are not even able to get up and down stairs or walk without a lot of pain. The solution to having a sufficient and adequate treatment for this destruction of joint disease in the knees is no longer just joint replacement. We have an alternative. We have an option of placing your own stem cells into the joint space. If we can intervene early enough, we can prevent the destruction of the bones where you have so much destruction that you can't avoid the knee replacement. By intervening, we can regrow cartilage, and we can see it on the MRI over 6 to 12 months of regrowth, and we can actually restore function, which is really exciting because it's going to prevent the necessity of having to have titanium or a joint replacement. Why don't we want a joint replacement? Well, there's the risks of surgery, infection, embolic phenomenon, those are blood clots, and problems with anesthesia, and a long convalescent period involving physiotherapy. So if we can avoid placement of metallic substances and bionic joints, we should do that. And by early intervention, by catching it early enough, we are able then to rebuild the cartilage and prevent that bone against bone destruction of the joint. Many of our patients have done quite well within the first 6 months. Others have done extremely well between 6 months and 12 months out. So we're seeing a lot of exciting changes. And I think the key to successful treatment of the knees is early intervention. When you start to have pain and you can see changes on the MRI or on the x-ray, that's the time to act. That way you can prevent, in many cases, total joint replacement. The final reason that many of us don't want to have the joints replaced is that many times within 15 years we have to place another joint, a new replacement for that knee. And that's, again, another exposure to surgical procedure, the downtime, the physical therapy, all of that. And this is something we would like to avoid. If you are interested in stem cell therapy for your knees, you can give us a call. Our number is 323-285-5300, or you may email us at info, that's INFO, at metromd.net. That's METROMD.net. Thank you. Bye.